Hi, I'm Dr. Michael House. I'm with All Natural Healing Medical Center here in Sarasota, Florida. I have been treating people now for over 20 years. I've helped thousands of people with all types of injuries. And today we're going to start to talk about knee injuries. And this one really hits home with me because I had gotten in a ski accident about 20 years ago and I tore my ACL. And I had to use an orthopedic surgeon to fix that, because when you tear a ligament, what that does is that will retract. And so what they do is they either take a cadaver or they'll take a third of your patella tendon and then they screw it in, and it takes 6 months for it to turn back into a ligament. And you're not supposed to do anything for that 6 months, because if you accidentally stretch that dead piece of meat out before it becomes a ligament, then you're going to have play in your joint. So after the 6 months, I was going to start to rehab, but I couldn't even walk up and down stairs without my knee blowing up. And so I went back to the doctor, who was a friend of mine. He was an orthopedic surgeon, and he'd been doing professional athletes for years, and he had done thousands of knees. And I went in and I asked him, "What'd you do to my knee? My knee's worse than it was prior to surgery." And he goes, "Well, I did you a favor. You also had a tear in your meniscus, and so I cleaned it by doing a mastectomy." I'm like, "What do you mean you cleaned it?" He goes, well, there's a tear in there, and when you have a tear in your joints, they don't fix, they just tear more. And every time that tear opens up, the two bones will touch each other, and then they freak out, and people will call it catching or grabbing or buckling. And so when you turn a certain way, it opens up that tear and tears it a little bit more, and the bones touch each other, and that's when it buckles. And so they don't want it to continue to tear because it won't mend itself, so they cut the tear out so it doesn't tear anymore. And when he told me that, I said, "Well, isn't that kind of like cutting cushion out of your couch?" He's like, "Dr. House, I've never heard anyone put it that way, but that's exactly what it is." And of course, the next question was, "Why would you do that?" And he goes, "That's just procedure." In other words, that's what they're taught in medical school. And my next question was, "You ever had knee surgery?" I mean, this guy had done thousands of them. And he said, "No." I'm like, "It doesn't work. I mean, my knee is worse than it was. You know, I have a hole where I had a tear." And so, a lot of doctors will tell you you have bone on bone, and that's just not correct, because there's no way you could walk. It'd be buckling or grabbing every time you stepped. And so I learned this procedure in the Far East, where I went over there and did a semester, and it was called Prolo Puncture, and it means proliferation of cells. It means growing of cells by an irritant. And the puncture means we use the acupuncture spots. And so what happens is when you cut yourself, you'll have scar tissue that mends the tear. Well, that doesn't happen in your joints. And so this product called dextrose is an irritant, and it irritates the tissue and it makes it lay down scar tissue. So we use dextrose. We also use B12 that helps it heal a little bit quicker. And we'll put some lidocaine in there, because when we put the shot in, if we didn't put lidocaine in, it'd be like ripping off a second or third degree burn and pouring alcohol in it. So it really starts to irritate the tissue, and your knee, the two meniscuses are inside of a capsule. So what we do is we put the shots on either side of the kneecap. It's actually called an acupuncture point called Hading. And then what it does is it's going to irritate that tissue for the next 24 hours. And so I put the lidocaine in there. So you got a half an hour to get home, and you need to start icing that. And as long as you ice it the way we're going to teach you how to ice it, you should be fine the next day. Now, the course of treatments are 10 treatments. And the fastest we can do them is every other day. You could typically do them once a week, twice a week, 3 times a week, but we need to do 10, and I know that for a fact because, like I said, I did it to myself. I had the medical knowledge since I'd gone to medical school, and I was the patient, so I knew if it was working or not. Because I always say, how do doctors know what they are doing really works if it was never done to them? And so they don't really know that if it works or not. They just assume it since that's what they were taught. And a lot of times it doesn't work. I mean, people end up getting different surgeries and then they have to be on drugs for the rest of their life. Or now they use joint replacements. And honestly, we're still guinea pigs to this joint replacement. It's relatively new. And in fact, there are a ton of lawyer commercials on TV with class action lawsuits against these joint replacement companies because they don't work. And so I always say, why don't you do everything all natural first, and then you can always get surgery. But if you were to get a joint replacement, there's nothing I can help with you. And as long as they don't cut out a lot of tissue, I can typically help you if you've had a mastectomy. But what we'll need is an MRI, because an X-ray just doesn't show soft tissue at all. So you need an MRI. We actually have an incredible deal with a company here in town where the first MRI is $250 and any MRI after that is $150. It's actually an incredible price, and it's probably the best price in the country. A lot of people will have insurance, and insurance makes you get an X-ray, and then they make you do 6 weeks of rehab before they'll let you get an MRI, and you could hurt yourself worse if you do it that way. Or people have large deductibles, and this is usually the easiest and fastest way. We can use MRIs if they're 6 months old. If you have an MRI a couple years old, that's a good starting point for us to talk. And if you have any questions at all, you can leave them in the comments section and I'll get back to you. You can also call the clinic at 941-953-3700, or you could even go on our website at allnaturalhealing.srq.com. You can read more about the Prolo Puncture. You can read about the different testimonials of people who I've helped with. And you can send me an email from there, and I can get back to you as soon as possible. And then we can set up the free consultation and come in. And if you have more questions you want to talk about, just write them down when you come in so you don't forget them, and we'll go over everything. And here at All Natural Healing, the first consultation is free, so it doesn't cost you anything to come talk to me and find out what's going on and how we can help you. I look forward to healing every one of you and getting to know you. Thank you for your time.